and I'm pleased to be here with you tonight. And congratulations on 100 years of good work. I am so happy to be here with you. And I want to thank you for inviting me because I didn't know very much about Pine Rest until I got the invitation. I looked you up in the internet, and also you sent me a lot of material, and it's just wonderful to be here tonight with people, helping people with others with mental illness have a better life. A wonderful Christian ministry. I have great respect and appreciation for you. And I just had a wonderful day, and one of the best things about it has been the wonderful people that I've been with today who are interested in mental health and mental illness and helping people have a better life. But I just enjoy being with people who work on mental health issues because I've done it so long and I feel a real kinship with you. Well, I'm going to be talking to you about experiences working in the mental health field, how I got involved, and about the situation for most people living with mental illnesses in our country. Most are not fortunate, like the ones who come to Pine Rest for help. And I've had a lot of experience in the mental health field. As the judge said, I've been working for many years, since Jimmy was inaugurated as governor. That was 1971. That's a pretty long time ago. And when I started working, nobody even wanted to be helpful to me because they didn't want to be involved with mental health issues. It was so distressing. I would call meetings when Jimmy was governor, and there were 5 advocates, and five is all in the Atlanta area. My 5 advocates would come, and a few government people because Jimmy was governor. It was so hard to get anybody to do, and that was the stigma. I mean, so stigma has improved, although we still have a very long way to go. I became interested campaigning for Jimmy for governor. This was a time when the Community Mental Health Centers Act had been passed, and people were still in those big institutions, awful institutions. And but they were being, at that time, there'd been exposés of so many of them across the country, including one in Georgia, and people were being moved out before the community centers were established. And every day when I campaigned, I had somebody ask me, what will your husband do for my mentally ill loved one in our central state, our big institution, when he's elected governor? And one morning, at 4:30 in the morning, I was standing at a cotton mill in Atlanta. That's a good place to campaign. You get people, this was a shift change, and you get people coming off from work and going to work. And this older woman emerged. She was all alone. She was small, a little stooped, and you could tell she was so weary from working all night. Her hair and clothes were covered with cotton lint. I said good morning to her and told her that I hoped she was going home to be able to get some sleep. And she said, I hope I can get some too. And then she told me that her daughter, she told me about her daughter who was mentally ill and about how she and her husband struggled to make ends meet. She said, I work at night while my husband stays with her, and he works during the day when I'm at home. And I had been hearing this so much, and then to see this poor woman trying to make ends meet so that they could take care of their daughter. I thought about it all day, and this was a very disorganized campaign, and we didn't win. Jimmy got in late when our main Democratic candidate had a heart attack and dropped out, and we didn't have very long to campaign. And so we're just getting in the car and driving. I had one of my sons with me. Other 2 sons went in different directions, Jimmy in another direction. So I was campaigning in Swainsboro, Georgia, and I learned that Jimmy was going to be there that night. See, it was not organized. So I stayed and went to a speech. I got in the back of the room. He didn't know I was there. It was a big rally because it was close to the election. And when his speech was over, I got in line with people that were going to speak to him. And And when I got to them, I don't know about you, but receiving lines are part of my life. And I will be talking to somebody, and then I'll reach for the next hand before I look at that person. That's what he did to me. So he took my hand, and when he got in front of me, he said, "What are you doing here?" I was supposed to be somewhere else, campaigning. I said, "I came to see what you're going to do for people with mental illness when you're governor of Georgia." He said, "We're going to have the best program in the country, and I'm going to put you in charge of it." Well, of course, he didn't put me in charge of it because I didn't know anything about it then, but he ran 4 years later. He was elected, and in January, right after he was inaugurated, he established the Governor's Commission to Improve Services for Mentally and Emotionally Handicapped, and he appointed me to that commission. And that was the beginning of my education about mental health issues. And then in the White House, I had a President's Commission on Mental Health. We worked hard for 4 years. We developed recommendations and even developed legislation. Got it passed in October of 1980. It was passed and funded. Jimmy signed the Mental Health Systems Act into law, October. We celebrated. It was so exciting. But our celebration did not last very long because in November, Jimmy was, as he says, involuntarily retired from the White House, and a new president came in, and he abandoned my legislation. It was one of the biggest disappointments of my life. Our bill was not perfect, but it could have made a significant difference. And even more distressing is that 25 years later, President George Bush had a presidential commission. And in 2003, the report of that commission was that the mental health system in the United States is in shambles, and there's no way to fix it. We have to start over. And that's the situation we're in today. And then when we looked at those recommendations, it was shocking to see how many of them were exactly the same things that my commission recommended 25 years before. So very little had been done since 1978. Since I first began working in the field, I have met hundreds, even thousands of citizens, young and old, rich and poor, people from all walks of life who have shared with me their personal stories of pain, suffering, and even loss of a loved one because help was not available. And what is so sad is we know what to do. During the past 2 decades, we've learned so much about the brain, and we now know that individuals can recover, many even from serious mental illnesses. We have effective treatments, good models for delivering them. We have early intervention strategies to prevent more serious problems later in life. This has all happened in the recovery and prevention in the last few years because of the research that's developed. And also because of the work of the consumers. Consumers are people living with mental illnesses. And consumers decided that they needed to take some part in their treatment. And they've made a total difference in how we look at mental illnesses and mental health now. But we are even beginning to understand how to promote resiliency in children at risk and in people struggling with the most serious disorders. I am so excited about what has happened and so frustrated that we're not doing what we know how to do as a general rule. This institution is doing a wonderful job working on recovery. I'm so excited about that and so pleased to be here. Many people have asked me why I decided to write this book, Within Our Reach. Well, I worked on the issue for so long, and we still have so far to go. And I often thought about what Margaret Mead, the great anthropologist, said to me. And this was one of the highlights of my life. When Jimmy was elected governor, Margaret Mead came to the governor's mansion to thank me for being involved. And she said, it's not going to be easy. And she was right. But she also said, if we select for our first consideration the most vulnerable among us, the emotionally disturbed child, the person institutionalized with psychosis, the street addict, then our whole culture is humanized. Well, after all my years of advocacy and the efforts of so many others, I am deeply frustrated and even angry. I get angry because we have failed to measure up to her standard. Within Our Reach is a serious book with important messages. This is an issue which touches every family in America at some time. Every family, no one is exempt. It does not discriminate, it touches anybody. Approximately 1 out of every 4 adults in our country is affected every year. 1 in 5 children. Statistics are just overwhelming to me. And the fact that we still have such stigma when everybody knows every family is affected, if not personally by close friends, and we still cannot get over the stigma. These illnesses do not discriminate, which I've already said, they touch every part of our society. Mental illness is our nation's largest hidden epidemic and a major public health issue. And I have been working for years trying to get the Centers for Disease Control to take on mental illnesses as a disease. What could we do if they surveyed our country, our communities, to see how many people were living with mental illnesses? But it's never been a part of what they do with other illnesses. But now I have, starting when Dr. David Satcher was at the head of CDC, we developed a working group with people in Centers for Disease Control. And I had an international program on recovery and prevention, and with scientists from all over the world. And when we had that, we invited this group from, we put on the group put on the in-house internet at CDC about it and said, asked for volunteers, and 75 people volunteered. That was one of the exciting things for me. So we do have them looking at the issue and working on it to some extent. I've been fighting the problem of stigma since my very early days in Georgia as an advocate. And I believe that stigma is the principal reason we have not made more progress in our field. Well, my hope is that my book will help dispel the myths and misconceptions about mental illnesses that cause so many people to keep their problems hidden and hinder all our efforts to help them. We work continuously at the Carter Center mental health program to try to overcome stigma. And one of the best programs I have is fellowships for journalism. We bring journalists to the Carter Center to teach them how to write about mental illness, to teach them the facts. And there's language that hurts people with mental illness. To say that a mentally ill person hurts a mentally ill person. They're not a mentally ill person. They are a person with hopes and feelings and dreams, just like we all have, but they have mental illness. We also teach the journalists to report on stories in depth, because almost every occasion when there's something sensational written up, it is because the mental health system failed them. And so if we need to know all the facts and instead of sensational stories, and I think that's beginning to improve a little bit. We've had over 100 journalists go through our programs. Well, it's time for all of us to speak openly and candidly about mental health issues and to draw attention to the incredible progress that has been made. This I repeat over and over. Today people can recover, because that is something, even in 1978 when we made the report of the President's Commission, it's something we never ever dreamed would be possible, and it's so exciting to me. The overwhelming majority of people living with mental illnesses can lead full and productive lives in their own communities, going to school, working, raising families. Much of our progress is due to the efforts of consumers, people living with mental illness. I've already mentioned that, but I tell the stories of some of them in my book. And I call it a revolution, one which recognizes that consumers can and must play a key role in their own recovery. For too long, and this is how we've treated people with mental illness down through the generations, and it's the way many of them are still treated today. For too long, they and others like them were told their cases were hopeless, they had no chance to live a meaningful life. That message is devastating and destructive. And today, all of that is changing. Hope for a better life based on strength instead of on weaknesses, on self-awareness and respect, form the foundation for a new way of thinking about living with mental illness. And I think that's beginning to happen in the whole country now. People are looking at recovery instead of telling people that it's hopeless for a meaningful life and for themselves. Ultimately, the way we treat people living with mental illness is a moral issue. To neglect those who, through no fault of their own, are in need runs counter to the values of decency and equality that we hold dear. Today, with our knowledge and expertise, we have a great opportunity to change things forever for all people with mental illnesses, to move forward to a new era of understanding, care, and respect. And you here at Pine Rest, you in this community who support the institution, are helping live up to Margaret Mead's standards by selecting for your first consideration providing quality service to those in this community who need help. I have the deepest respect and admiration for you. Thank you very much.